Assalamualaikum viewers and welcome back to my channel BioDenver's Hub. Now we will be discussing the Caldwell loop approach in detail. So it basically involves creating an opening into the maxillary sinus through the canine fossa via the sublabial approach. Why canine fossa is considered? It is because the bone here it is thinnest and it is very easy to access the sinus through the canine fossa. We will be studying the indications and contraindication for the Caldwell loop approach that was basically creating an opening into the maxillary sinus through the canine fossa via the sublabial approach in order to extract out those root fragments that were displaced into the sinus or any tooth that has been displaced into the sinus. So indications for the Caldwell loop approach involves the intrasinus foreign body if it is present, so we can use this approach for removal of that foreign body, or any intrasinus cyst and tumor, chronic maxillary sinusitis in case of oral antral fistula and mycotic fungal balls, or in case of the epistaxis control. We can also use this approach for the midface or orbital floor fractures, and you can also use it for the antral polyps or variant neurectomy or in the transantral access for tumor in the pterygopalatine fossa. So these were some common indication in which we could use the Caldwell loop approach. Now we will be studying some contraindications as well, that in which cases this procedure or this approach cannot be performed. So first of all, it cannot be performed in the children's. It has following reasons. First, that there is increased chances of injury to the succedaneous teeth. That's why you cannot use this approach out there. Secondly, there is a very close proximity of the orbital floor and the teeth because we have an underdeveloped maxilla and it has a thick bony wall as well. Secondly and thirdly, we have the growing sinus. The sinus is growing and increasing its volume eventually. So, in that case, also we cannot use this approach. Secondly, in case of any acute infections, for example, osteomyelitis or septicemia, you can again not use this Caldwell loop approach. Or in case of any midfacial trauma, which may have disrupted the orbital floor, so in that case, also the Caldwell loop approach is contraindicated. Now we will be studying some surgical steps that are involved in this procedure. First of all, patient need to be in supine position with the head and the neck fixed on the trunk. Secondly, you have to give the local anesthesia or general anesthesia depending upon the indication. After that, you need to retract the lip, and after that, you need to make a sublabial semilunar mucosal incision gingivo-labially from the lateral incisor to the second molar from 1 centimeter from the gingivo-labial sulcus. So here it is the location of the incision. After that, the subperiosteal dissection is performed with a periosteal elevator. Then identify the canine fossa on the anterolateral aspect of the maxillary sinus and draw a line vertically that will be passing from the pupil of the eye and that dissecting line drawn laterally from the ala of the nose, and this will mark the location of the canine fossa. With this approach, you can locate the canine fossa. After identifying the canine fossa, you need to preserve the infraorbital nerve and its branches. Now, after that, through the osteotome or mallet or burr, you need to make an antrostomy, that is the opening into the sinus in the thin bone of the canine fossa, also known as the bony window preparation. After that, you need to inspect the antrum with your index finger. You should check it out and inspect the antrum. After that, if it is needed, you need to enlarge the antrostomy either with the Ranger's bone nibble or drill. In that regard, you need to avoid any injury to the neurovascular bundle out there. After you have done your antrostomy preparation, you need to address the underlying pathology. Whatever was the indication, either it was a displaced root fragment, either it was a cyst, either it was a foreign body, either it was a tumor, which you need to remove. And after addressing the underlying pathology and its removal, you need to irrigate the sinus and then control the bleeding from the edges with the electrocautery tip or bone wax. Or you can also use 1 ratio 1000 adrenaline soaked gauze for 1 to 2 minutes, and it will also help you to control the bleeding. After that, you need to close the wound with the absorbable sutures. After you have performed your Caldwell loop procedure, you need to give some post operative instruction as well, and the patient has to follow that. First of all, you should ask the patient not to blow through the nose or sneeze for 4 to 5 days. You should be prescribing the antibiotics, the analgesics, the nasal decongestant, and in case of the drainage, combine Caldwell loop procedure with the intranasal enterostomy. Now, there are certain complications that can also result as a result of the Caldwell loop approach. Number one, we can have the infraorbital nerve paresthesia or the numbness of the canine and premolar teeth. This may occur due to the excessive removal of the bone in the dentate patient or injury to the anterior superior alveolar nerve. We can also have the epistaxis or sublabial oroantral fistula. We can also have the osteomyelitis of the maxilla as a complication, and also as a complication, we can also have the injury to the nasolacrimal duct with the inferior meatal astrotomy. Subcutaneous emphysema, the globular injury, orbital floor injury, or orbital hematoma, proptosis, or blindness. These were all the complications that can occur as a result of the Caldwell Luke approach. Now we will be studying another case in which the entire tooth displacement has occurred into the infratemporal fossa. And again, the most commonly involved tooth is the impacted maxillary third molar. We will be studying the causes as well. So, causes include elevator, which may force the tooth posteriorly into the infratemporal fossa during the elevation, or the distopalatal angulated tooth, or decreased visibility during the surgical removal of the impacted maxillary third molar, or the lack of bone distal to the tooth could also be a reason of displacement of the tooth into the infratemporal fossa. So, what is the management of the tooth displacement into the infratemporal fossa? First, the tooth lateral to the lateral pterygoid plate and inferior to the lateral pterygoid muscle. It will be located out there. If good light and access is available, then attempt should be made to retrieve it back through the hemostat. If it is not retrieved, avoid blind probing. Close the incision and inform the patient that the tooth has been displaced and it will be removed later. During the initial healing, fibrosis may occur and it will stabilize the tooth in firm position. The tooth it is then removed later on by the oral and maxillofacial surgeon after the radiographic localization. So this was all about the management of the root displacement of the maxillary molars. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also hit on the bell icon so you will get notified about our future videos and updates. And our third video will be about the root displacement of the mandibular molar. So stay tuned. Thank you.